Dental fillings are an everyday dental procedure which helps fix damaged or decayed teeth. But many are concerned whether dental fillings will remain and when they will have to be replaced. In this clip, we'll explore elements that influence the durability of dental fillings, as well as offer guidelines on ways to keep them in place longer than they should. What is a dental filling? Fillings for dental cavities are made of materials. They serve to fill holes within the teeth that result from dental decay or damages. The most commonly used forms of dental fillings are amalgam, a combination of various metals, and composite resin, a tooth-colored substance, or gold ceramic. The filling material you choose will be determined by the site and extent of the tooth in addition to the individual's preference. How long do dental fillings last? The longevity of a filling is contingent upon many factors, such as the filling type utilized, the dimensions and placement of the dental cavity, and oral hygiene routines such as diet and eating, as well as habits like teeth grinding. In general, dental fillings will last between 5 to 15 years, although some last longer when properly maintained. Certain factors can affect the durability of dental fillings. 1. The type of filling material used. Materials vary in quality of life. As an example, amalgam fillings can be stronger and last longer as compared to composite resins. Fillings made of ceramic and gold can have a longer lifespan, however, they're also costlier and not as frequently employed. 2. Dimensions and the location of the tooth. The dimension and the location of the tooth can influence how long the filling is lasting. In high-stress locations, for example, the teeth that are used in back for chewing could get worn out faster than those located in less stress zones. 3. Habits of oral hygiene. Good oral hygiene is vital to prolonging the lifespan of fillings for your teeth. Regularly flossing, brushing, and regular dental examinations are a great way to avoid damage and decay, which could require replacement of fillings. 4. Food. Consuming a diet rich in acidic or sugary food as well as drinks may contribute to degrading and the loss of fillings. Eliminating these foods and ensuring healthy eating habits can keep your fillings. 5. The process of grinding and grinding the teeth, called bruxism. It can create extra stress on the dental fillings and lead their wear to accelerate. A night guard helps protect your fillings against the damage of grinding your teeth. How to extend the life of dental fillings. 1. Keep your mouth clean. Clean your teeth at least twice each day. Floss every day and see the dentist frequently for cleanings and checkups. 2. Do not eat acidic or sugary food and drinks. Limit your consumption of foods as well as drinks that may be a cause of decay or the loss of fillers. 3. Wear a mouthguard. You are a grinder regularly. Take into consideration wearing a mouthguard every evening to guard your fillings from wearing and wear. 4. Be proactive when you feel sensation of pain or discomfort near a filling or a tooth. Visit your dentist as soon as possible so that you don't cause further damage to the filling and tooth. The final conclusion is that dental fillings are able to last between 5 to 15 years according to various aspects. Through proper oral hygiene as well as consuming a balanced and healthy eating routine and abstaining from bad routines like grinding your teeth, you'll be able to extend the longevity of your fillings. If you're concerned concerning the long-term durability of your fillings, be sure to talk with your dentist to receive personalized assistance and advice.